Hello everyone. In our last session, I gave a brief overview of diabetes, but today I'm going to provide a much more detailed explaining the type of diabetes that we have. So when we talk of diabetes, basically we have three main types of diabetes. We have one as the type 1 diabetes, we have the type 2 diabetes, and we have the gestational diabetes. So let's take them one after the other and explain it as such. So when we talk of type 1 diabetes, it happens because the immune system attacks the cells in the pancreas that makes the insulin. This means people with type 1 diabetes produce almost no insulin at all. As a result, they need insulin injection every single day. There is no cure. So with this type of diabetes, there is no cure. So it is a lifelong management with regular blood sugar check and insulin injections. So now let's talk of the type 2 diabetes. The type 2 diabetes is different. Here, the body either does not make enough insulin or the cells don't respond to it well, that's effectively. So it's often connected to lifestyle like being overweight, not exercising regularly, or poor diet. The good news is in many cases, type 2 can be managed. People often start with lifestyle changes, improving diet, getting regular exercise. Sometimes, though, medication like metformin and other oral drugs are needed. In some cases, even insulin is even needed in type 2 diabetes. So now let's talk of the third one, that's the gestational diabetes. This one happened during pregnancy. So the pregnancy hormone make it harder for the insulin to work very well, leading to high rise of sugar in blood. So after the baby is born, it often goes away, but it is really important because it raises the risk of type 2 diabetes later on in life. So women with gestational diabetes often need careful monitoring, a special diet, and sometimes medication. But once the pregnancy is over, a lot of times their blood sugar returns back to normal. In all types, the goal is to keep the sugar level in a healthy range so we can avoid complications like heart diseases, nerve damage, and vision problems. If you or someone you know is dealing with diabetes, it is all about balance. Eating well, staying active, taking your medications if needed, and checking with your doctor regularly. That's your blood sugar. So thank you very much. Kindly like my video, share, and forward it to others for them to have the benefit of this video. We shall meet in our next episode. Thank you very much.